Welcome back, everybody, to our third OAO member spotlight. And today I'm happy to have with us Dr. Radhika Chawla. She's going to speak to us about ICI-Learn and children's vision. Good morning, Radhika.
Good morning.
Could you kick off the interview for us by telling us a little bit about yourself, please?
Absolutely. So, after completing my undergrad in biology at McMaster, I, like many of us, went down to the US for optometry school. So I graduated from the State University of New York College of Optometry in 2003. I had the opportunity to stay and practice in the Department of Ophthalmology at the Beth Israel Medical Center. So that was a great experience because we had different disciplines of ophthalmology that we got great exposure. I came back to the GTA and just under 3 years ago opened my own practice in Richmond Hill, and also am an associate with an ophthalmology group in Brampton and Mississauga. So in Richmond Hill, it's a full scope optometry practice. There are 3 of us optometrists, and as you know, I have a keen interest in children's vision. We also do low vision and specialty contact lenses.
So if your practice has been open for 3 years, how has ICI-Learn helped grow your practice?
So just to begin with, I feel ICI-Learn is an excellent program. So it's a positive program. It is great for the children in Ontario. It's ensuring that, as you know, they're starting school without any visual obstacles to learning. So for the children in Ontario, I think it's a great program. As an optometrist, it's essentially really rewarding. I think it's a great way for us to let the community know about what we do as optometrists, what our services are, and it's a great practice builder. So some of our ICI-Learn stats show us that the children who are coming in for their ICI-Learn exam, 65% of them, it's their first eye exam. So this is their first time, possibly them as well as their families, in our offices. So usually when the parents are in with their children, this motivates them to have their siblings or other children have their eyes tested, as well as sometimes shines a light on the fact that the parents haven't had their eyes tested, and essentially allows optometrists to be recognized as the primary eye health providers in the community. So it really allows us to get out there and let people know what we do. For myself, as a starting a cold practice, it really has made a difference and helped generated referrals, which our members would see also.
So getting that JK student into your exam chair, you find you get a bit of a cascading effect where you'll get siblings, parents, so you'll get a whole bunch of new patients from that one eye examination. Is that a fair statement?
Absolutely, because one thing that I'm sure all our colleagues have experienced, and I've definitely experienced, is there's not a lot of awareness. So the frequency of eye exams for children, as well as OHIP coverage, is something that I feel is not fully known by families and parents, and it is a great way to get the word out and allow people to know what we do.
So can you talk about some of the outreach activities you've done, and maybe in 2 parts? The first part being sort of some community outreach you've done around ICI-Learn, and then more particularly schools, because members often ask, how do I get my foot in the door? How do I approach schools? How do I get them to be receptive to our message?
Absolutely. So this is the part that I enjoy most, and I'm sure a lot of our colleagues love this part of it, is getting out into the community, speaking to families, to parents, to other healthcare professionals, just to let them know about the ICI-Learn program, as well as optometry in a whole. So in York Region, or Richmond Hill specifically, some of the things that I've done, I've reached out to local GPs and pediatricians, met with them, presented about ICI-Learn as well as children's vision in general. I've reached out to and made connections with public health nurses, family health teams. I've contacted daycares and Montessori schools where I've gone in and done presentations for the children. So a fun presentation about the eye that is interactive and they seem to enjoy, as well as involved in some parent education nights to do presentations about ICA Learn. Contacting local media, so for Richmond Hill, it'd be the Richmond Hill Rogers TV, let's say, or whichever regional TV program they have, and be involved in a segment to talk about children's vision as well as the vision in general. I've inquired about various health expos or community fairs where I've set up a table and used the OAO resources that we have, such as the ICA Learn banner, Fribbit, all the various brochures that we have to educate about the program. Also, one which was very beneficial, I thought, was I contacted the Earlier Center locally. And they have a program called Getting Ready for K. So it's where the parents come in and they're kind of prepped and educated on the various steps that they may need to take to educate, to prepare their child for kindergarten. And so they were kind enough to let me come in and do a presentation to the parents about ICA Learn and children's vision, and I was able to coordinate optometrists in York Region to go to other cities and do the same program in their centers. So there's a lot of different avenues to get the word out. Reaching out to schools is a real major benefit of ICA Learn. So generally we're not permitted to be in the schools as individuals, but a benefit of being an ICA Learn provider is that you can adopt a school. So essentially you are an ambassador to that school, and you can go in and contact the VPs, principals, the secretaries, and educate about ICA Learn to their staff, to the teachers, be involved in JK nights or other educational programs they have. So one thing that I'd like to share is our Children's Vision Committee has worked really, really hard, and we've prepared various tools and resources. So for all of this outreach into the schools as well as within the community, we've created presentations, templates for communication, in addition to all the OAO brochures and pamphlets that we have, and the Fribbit, which we can use, as well as the brochures, as I mentioned. All of this would make it a lot easier to do this outreach, because I understand in our day-to-day practice we may not have time to sit down and prepare these presentations and these templates to do the communication. So we're really excited. That should be available on the website soon enough for our members.
Well, those are some great great ideas on how to outreach, and obviously you've done a ton of work in your community. And I think it's important to let members know that school boards typically have endorsed the program. The schools themselves have received materials from the OAO and from ICA Learn. So when you come knocking on the door and introducing yourself as an optometrist who's adopted the school, they will have had a heads up. So you're not walking in cold. So I think you guys at the Children's Vision Committee have done a wonderful job informing the school. So when optometrists on the ground do approach them, at least they've heard of the program. And one thing I forgot to mention is you're also chair of the Children's Vision Committee. So not only do you do a lot of this work at the local practice level, but you do a ton of work at the OAO. So thank you for that, Radhika.
Well, of course, I love being involved like this.
So as chair of the Children's Vision Committee, what do you see as the biggest impact on the profession as a whole as far as ICA Learn goes?
So we all are aware of the statistics that we know, that 80% of learning is visual. We do know the number of children that would have a visual problem that would affect learning. A statistic that I learned through my involvement is that 90% of our children haven't had an eye exam with an optometrist under the age of 4. So I think this is a fairly significant statistic that we should all be aware of, and it just brings light to the fact that I think, in my opinion, we all need to work together collectively to bring, to raise awareness and to allow those behaviors to change, because in the end this is going to positively impact the children's futures as well as ours. So I think collectively we need to come together and work hard to promote ICA Learn and the importance of children's vision.
Exactly. I think it's incumbent upon us as eye care providers to to do that, because if we don't do it, who's going to?
Mhm.
So I'd like to thank you for taking time this morning out of your practice schedule to chat with us, and I look forward to seeing the toolkit that your committee is developing and will soon be available on the OAO website. So
I
thank
think
you very much again, Radhika,
no
for your
problem. I
time.
think members will really enjoy it.